The now infamous White House request for citizens to report all, quote, fishy comments about healthcare reform has made doctors angry. In fact, they're more than angry, they are suing. The Association of American Physicians and Surgeons is now filing a lawsuit against the White House, claiming that the initiative was a violation of its members' free speech rights. Joining us now to explain the complaints is Catherine Sirks from the Association of American Physicians and Surgeons. Catherine, thanks very much for coming back again.
Hi, Stuart. You're going from one feisty woman to another, so here we go.
I'm backing right off, Catherine. I'm backing right off. Have your members, do you know for a fact that your members, have they been reported to the government? Because I know that your association does not approve of President Obama's plan for healthcare reform. So have some of your members been reported?
Well, actually, some members self-reported and proud of it. What I can tell you is that my hate mail really started very shortly after the White House website went up and the solicitation went up. Up until then, I was getting some normal things, but I started getting the shame on you and the all doctors are bad and the greedy and some really serious, nasty emails.
So what do you do? Okay, you're suing the government to do what?
Well, first of all, we're telling them to stop collecting any more data. Even though they've taken down the flag at whitehouse.gov, they've kind of switched it around to a reality check. So they haven't completely quit. Plus, that email still exists. It's just not currently in use, which means it could be activated at any time for use. So cut it out. Number two, cut it out in the future, and number three, to expunge all of the data that they collected already. It's not just a free speech issue, it's also a privacy issue. And I want to point out again that this has everything to do with health care and nothing to do with health care. On the nothing to do with health care side, we also have taken previous administration's task for domestic spying and surveillance and some overzealous efforts in that area. So this fits right in with things that we've done in the past. Now, it does have everything to do with health care in the sense that the White House really has used this as a tactic to chill speech of the opponents against them.
Okay. Let's deal with one of those issues right now, because we hear about these death panels. It's not an expression that I want to use. I want to refer to the end-of-life consultations where options are presented to the patient. Now, do you object to the government organizing these panels and instructing these panels what options to apply to patients? Is that your objection, or is it an objection to the whole idea of end-of-life panels in the first place?
Okay, end-of-life panels, yes. End-of-life counseling, no. Now, here's the deal. It should be, end-of-life counseling should be available, but not with a government mandate on what should be said and how it should be done and the calendar of events and how many times it should be mandatory.
Why not?
Big difference then.
But why not, Catherine? I mean, somebody has to lay the law down and what options are available. We don't have infinite, unlimited resources. What's your objection to the government to doing this?
That's not the role of the government. That's a decision to be made between physician and patient and their family, not the government. Let me give you an example, too. It's really interesting that in the current provisions, in the current proposals, they're willing to pay doctors to spend time counseling, doing end-of-life counseling, and yet they also yell and scream about chronic disease management. Doctors aren't actually paid to manage diabetes, to do diabetes management, and that's one of the things that the President took doctors to task for in one of his previous statements about it's easier to amputate rather than to counsel. Well, maybe they should start to look at some other counseling as opposed to just end of life. Now, but here's the key thing. What the President has done is the President's been talking about death panels. We haven't talked about death panels. We've talked about end-of-life counseling. And so by using this whole tactic of slamming his opponents with his misinformation, it really is kind of a switch and bait, a rope-a-dope to take the focus off of what he's actually saying, or maybe more importantly, not saying.
Got it. All right, you're just getting feisty, and I'm sorry to cut you off in midstream there, but Catherine, come and see us again, please. Catherine Sirks, thank you very much, ma'am.